For our first community conversation, we're joined by Dr. Patricia Rodriguez-Lozano, a women's heart specialist with UVA Health. She's sitting down with Aaron.
Dr. Rodriguez-Lozano, great to have you here today.
Thank you, Maya.
You are very welcome. So you are a women's heart specialist, and Wear Red Day is coming up in just a few days, and that is a day where we kind of raise awareness for women's cardiovascular health, correct?
Yes, exactly right. And Wear Red Day, Wear Red Dress Day is really a very powerful day. It's an opportunity, exactly what you said, to raise awareness about heart disease to be the main #1 killer of women.
Wow.
And this tradition started back in 2004 when the American Heart Association released their first campaign, Go Red for Women. And it's exactly that. It's an opportunity to have these conversations and talking about how heart disease is really the main threat for the health of women. And it's not only for women, men also wear red. And then we started having this conversation and increasing awareness.
Right. And raising awareness is so important, just to, kind of get the word out there. And I personally didn't know that heart disease is the #1 killer for women. So it's good to raise that awareness and get that knowledge out there.
And this happens every year.
Yes.
It's the first Friday on February. Every year we do this. And to be honest, I actually wear red the whole month. It's my way just to keep this conversation going.
That's good.
And keep increasing awareness and knowledge about heart disease in women.
Absolutely. And what are some of the unique heart challenges that women face?
Yeah, it's so important. Women, I think traditionally it was thought that heart disease was a disease of men, and that is so far to be true, right? It's just women sometimes we present in a different way, maybe different symptoms, maybe different kind of heart disease, but also our risk factors for heart disease are different. And things are I think this part is very unique for women. Things like, for example, having history of polycystic ovarian syndrome, complications during pregnancy, like hypertensive disorder of pregnancy, gestational diabetes, all that will increase the risk of women. Our age of menopause, like having early onset of menopause, let's say less than 45-year-old of age, that will matter for women. So all these are important.
Absolutely. And what specialized services for women are offered at UVA Health's Heart and Vascular Center?
Yeah, Heart and Vascular at UVA, we created this very special program. It's called the Women's Heart Care Program. And I'm very humbled to serve as the director of this program. And we have created this specialized team-based approach. And we have different clinics that take care of women and this uniqueness of heart disease in women. One of our clinics is we call it the Women's Clinic, and it's a prevention clinic. Also, we see microvascular disease, that is a disease of the tiny little arteries of the heart, and that is actually my area of research. We have clinical trials, NIH-funded trials. We have another clinic called the SCAD Clinic, a spontaneous coronary artery dissection clinic. It's a kind of heart attack that happens mostly in young women. And then we have our cardio-obstetric clinic for women that are pregnant, have heart disease, or they are at high risk for heart disease. And all this is team-based approach. We have nutritionists, pharmacists, exercise physiologists, mental health specialists for women. Things like depression, anxiety will increase their cardiovascular risk.
Wow, so you have a full team specialized just for women's health.
Yeah.
That's wonderful.
Yeah.
That is great. And again, Wear Red Day is this Friday.
Yes.
So make sure you get your red on. I see you have yours on today.
I have my red on, and
Yes.
it's going to be like this the whole February.
The whole month. Good. It's important to raise awareness for women's heart health.
Yeah.
So, Dr. Rodriguez-Lozano, it was great chatting with you today. Thanks for coming in.
Yeah, it was a pleasure.
You're very welcome. All right.